Selamat petang dan salam sejahtera saya ucapkan kepada Guru Penasihat Persatuan Bulan Sabit Merah Malaysia SMK Segeraha yang terting telefon Barisan Ejekis Sesi 2021 hingga 2022 dan para ahli yang saya kasihi sekalian. Jadi, pukul jam sudah sampai 2. Marilah kita memulakan mesyuarat kita pada petang ini. Sebelum kita teruskan mesyuarat, marilah kita menyanyikan lagu PBSN bersama-sama.
Bulan sabit merah di Malaysia, giat berjasa untuk negara, tidak kira kaum dan agama, waktu aman atau bahaya. Di mana jua adanya sengsara, di sana ada kita. Di darat dan laut kita bersedia, walaupun diancam bahaya. Bulan sabit merah gerakkan sedunia, membantu semua yang menderita, rela berkhidmat dengan tabah dan bersemangat.
Seterusnya, mesyuarat akan diteruskan dengan laporan kehadiran oleh Nicholas Lim Bing Zi.
Terima kasih saudara Jasehi. Seramai 49 orang yang hadir ke mesyuarat ini.
Terima kasih saudara Nicholas Lim atas laporan kehadiran. Seterusnya, merupakan sesi pengesahan minit mesyuarat yang lepas dari saudara Vincent, dipersilakan.
Terima kasih kepada saudara Jason He. Sekarang merupakan pengesahan mini mesyuarat yang lepas tarikh 12 November 2021 Jumaat 2 PM hingga 2:10 PM. Mesyuarat am ke-27. Tempat Google Meet, guru yang hadir Cikgu Tin Xiaomo. Bilangan kehadiran 54 orang. Mini mesyuarat 1.0 kata alu-alukan pengerusi unit 1, 1.1 pengerusi unit Jason He Liang Chen dalam alu-alukan kedatangan semua ahli ke mesyuarat ini. 1.2 AJK dan ahli-ahli dalam menyanyikan lagu BSNN dengan penuh semangat dan serius. 2.0 kehadiran. 2.1 seramai 54 ahli telah menghadiri ke mesyuarat ini. 3.0 pengesahan mini mesyuarat yang lepas. 3.1 setiap usaha 2 unit Vincent telah membentangkan mini mesyuarat yang lepas. 3.2 pencadang ialah saudara Inai Chi dan penyokong ialah saudari Yong Fei. 4.0 lain-lain. 4.1 National Young Online Gathering ke-10 yang diadakan pada 22 November 2021. 4.2 pertandingan menulis Humanitarian Journalist 2021. 2021. Pertandingan ini dijalankan pada 3 hingga 5 petang. 4.3 pelajar tingkatan 6 bawah dikehendaki mengisi maklumat di link yang diberikan supaya dapat mendaftarkan diri sebagai ahli yang sah di bawah BSNM. Mesyuarat ini telah ditangguh pada 2:10 PM. Jadi saya memerlukan seorang pencadang. Terima kasih kepada saudara Inachi dan sekarang saya memerlukan seorang penyokong. Terima kasih kepada saudara Tan Sikap.
Terima kasih saudara Vincent. Seterusnya, saya akan serahkan masa kepada Cikgu Ting untuk menjelaskan aktiviti yang akan diadakan pada masa depan. Jadi, Cikgu Ting dipersilakan.
Seizures may occur when the normal functions of the brain are compromised by injury, illness, poison, disease, fever, lack of oxygen or infection. Approximately 1 in 20 children under the age of 6 will have a seizure. These are caused by a high temperature associated with illness.
Mum, I think it's happening again.
All right, that's okay. Let's get you to the ground. Just straight down to the ground.
Seizures are also caused by a chronic condition known as epilepsy.
Well done, Jess. Getting yourself down. That's great.
About 1 in 200 Australians has been diagnosed as having some form of epilepsy, and it is usually controlled with medication. All seizures require first aid care because the casualty needs to be protected from dangers that may cause injury during a seizure. It is not necessary to restrain the casualty or prise their mouth open. Once limbs cease to spasm, check airway and breathing. If breathing effectively, turn the casualty onto their side until consciousness returns. Assess for and manage any injuries. People who have a seizure in a wheelchair can be managed in the upright position using the same principles. Call an ambulance only if the seizure lasts for more than 5 minutes, another seizure quickly follows, the casualty has been injured, or they have a history of diabetes. Diabetes is a condition involving the pancreas, which produces insulin. This hormone regulates the body's blood sugar levels. The pancreas of a person with diabetes produces insufficient amounts of insulin, ineffective insulin, or possibly no insulin at all. A person with untreated diabetes will have very high blood sugar levels, known as hyperglycemia. Hypoglycemia is not commonly seen by first aiders, as the condition is likely to occur slowly over several days. However, it may result in unconsciousness. But hypoglycemia, which is too little sugar in the blood, is more commonly encountered. Hypoglycemia is usually rapid in onset and may occur if the casualty has taken too much insulin, participates in unplanned or unaccustomed exertion, or when a meal has been missed. The casualty may feel weak, dizzy, appear pale and sweaty, and experience muscle tremors.
Maybe a soft drink as well? Could you get me a soft drink?
Sure, you're right. Okay.
Confusion and irritability may progress to unconsciousness. If the casualty is conscious, give sugar, for example, a sugary drink or 6 to 8 jelly beans.
Here, would you like this? Thank you. Get it open.
This may be repeated every 5 minutes until the casualty recovers. Once recovered, eating a small meal is recommended. The casualty should be advised to seek medical attention.
It's been really busy this morning, and I should have got to lunch, and so I've just left it a bit late. But
How to treat heat stroke. Heat stroke occurs when the body is unable to cool itself. Knowing first aid techniques to treat this dangerous condition could save a life. You will need a cool area, cool water, a cool bath, or damp sheets, drinking water, and a thermometer. Optional, a fan, and sports drinks. Consult a physician for care and treatment advice if you suspect heat stroke. Step 1. Know heat stroke symptoms. Look for a headache, dizziness, confusion, exhaustion, seizure, high body temperature, rapid heartbeat, dry skin, and hallucinations. Step 2. Move a heat stroke victim into a cool, shady area or an air-conditioned building. Step 3. Remove the victim's clothing. Apply cool water to their skin or wrap them in damp sheets. Place them in a cool bath if they are conscious and able to cooperate. Accelerate body cooling using a fan to blow cool air across the patient's skin. Step 4. Provide cool drinking water to increase hydration if the victim is able to accept it. Offer sports drinks to replenish both fluids and salt. Step 5. Continue treatment until you verify with a thermometer that the person's temperature is 101.3 to 102.2 Fahrenheit. Step 6. Keep the person in a cool area and ask them to lie down with their feet elevated. Bed rest combined with rehydration will get them on the road to recuperation and recovery. Did you know? Heat waves result in more deaths in the U.S. than hurricanes, tornadoes, floods, lightning, and earthquakes combined.
God, I feel really dizzy. Amy, what's the matter? I feel really dizzy. Do you think you're going to faint?
Yeah.
Fainting is caused by a brief lack of blood flow to the brain. When a casualty feels like they're going to faint, do not let them put their head between their knees, as the casualty may fall when they become unconscious and can cause themselves further injury. The aim of first aid is to try and improve the blood flow back to the brain. So what we need to do is we need to lay them down on the floor and raise their legs. Amy, can you just come with me, darling? Let's just get you on the floor. Can you just stand up? Okay, just nicely does it gently. Lay me back for me. Lay me back for me. Just going to raise your legs for you. I'm just going to try and get the blood flow back to your brain, okay? Try and keep the legs above the level of the heart, as this will help to improve blood flow back to the brain. Another thing we need to do is, if there's a window, open the window to allow fresh air to come into the room. And then just watch and monitor the casualty's face for signs of recovery.
What if they're not waking up?
If the casualty does not recover and they stay unconscious, then you need to lower their legs, check their airway and breathing, and put them into the recovery position.
Okay.
Check for danger before approaching a casualty. Find out if they are conscious by gently shaking their shoulders and speaking to them. If they don't respond, check whether they're breathing normally. Open their airway by putting one hand on their forehead and gently tilting their head back. Lift the chin by placing 2 fingers on the point, taking care not to put any pressure on their neck, which could block their airway. Look for movement of their chest, feel for breath on your cheek, and listen for sounds of breathing for 10 seconds. If they are breathing, put them in the recovery position. First, take their other arm and place the back of their hand against their cheek. Grab their far leg and pull it towards you. The body will roll over easily. Tilt their head back and lift their chin to make sure their airway is open, and check for normal breathing again. Finally, adjust their leg to ensure they are stable. The recovery position helps them to continue breathing as their airway remains open, and they will be stable and won't roll onto their back.
Can I help
After
you?
confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts.
In this video, you'll learn what action to take to save a choking baby who is less than 1 year old. There are 3 possible scenarios to envisage. Scenario 1. The baby is still breathing. Monitor the baby, but do nothing else. Coughing is more effective than first aid procedures. Scenario 2. The baby is no longer breathing but is still conscious. Give the baby 5 blows to the back. Lie the baby on your forearm so that their head is lower than their chest. Support their head with one hand and place 2 fingers of your other hand either side of their mouth without pressing on their throat. Give 5 blows between the shoulder blades with the heel of your hand. If this does not work, alternate with 5 chest thrusts. Place your forearm against the baby's back, holding their head in your hand. Turn them over. Their head should be lower than their body. Place 2 fingers in the middle of the breastbone. Compress the chest by a third. Repeat the chest compressions up to 5 times. Alternate 5 back blows with 5 chest thrusts until the baby begins to breathe normally. Scenario 3. The baby is no longer breathing and loses consciousness. Lie them on a flat surface. Call the emergency services straight away. Begin cardiopulmonary resuscitation by alternating 30 chest compressions with 2 rescue breaths, if you know how. If not, use chest compressions only, at a rate of 2 per second. If the baby does not resume normal breathing, continue until emergency services arrive.
Okey, terima kasih kepada Cikgu Ting Xiaofeng. Sekarang kami akan mainkan satu Kahoot quiz. Saya akan bagikan camping di chatbot. Kamu typekan camping itu dan tunggu hingga jam 2.50 dan kami akan mulakan game session kita. Inilah camping. Saya sudah lihat Yong Fei sudah masuk ke room ini. Saya akan tunggu hingga 2.50. Then I will start the game. Kamu type Google Kahoot dan typekan camping ke dalam camping itu. Hanya 4 orang saja sudah join ke dalam room ini. Ready 10% more? 11. Any more? 1 minute left. Then I will start the game. The game ping is 8592648. 18%. 21. Okay, now I will start the game. Okay. Okay, let's see the first question. Manakah pernyataan di bawah bukan tanda-tanda penyakit yang mengeran dengan tiba-tiba? A. Penyakit AIDS. B. Sakit kepala yang teruk. C. Kehilangan kawalan badan. 4. Ciri birit. Can choose your answer A, B, C, D. 5 seconds. 4, 3, 2, 1. Okay. So let us see the answer. The answer is penyakit AIDS. Okay. Dia bukan tanda-tanda penyakit yang menyerang dengan tiba-tiba. Okay. Next question. 197 adalah tempat pertama. Sekarang dan Yongfei, Xia, Mark Eden dan Golden. Okay. Next question. Berapa kalikah tepungkan perlahan pelula diberi di atas belakang bayi yang tercekik? Okay, already 10%. Answer the question. Any more? A is 2, B is 3, 4 and 5. Which is the correct answer? Okay, any more? Okay, the answer is 5 times. 9% correct. Okay. Let's see the standing. Okay, Inachi still got number 1 and Yongfei number 2, Xia, Huixing number 3, Essendra number 4 and Claire number 5. Okay, next question. Berikut merupakan langkah-langkah untuk dilakukan sekiranya si mangsa mengalami stroke haba kecuali ya. Read the question carefully. Okay, 2% answer the question already. 10%. 12, 13. Any more? 1% lagi. Okay, time's up. Okay, the answer is memberikan bantuan pernafasan. Okay, next question. Okay, Xia Huixing, congrats. Continue to number 2 and Yongfei number 3. Biden and Desmond also number 4 and number 5. Okay, next question. Number 4. True and false question. Anda perlu memberikan kebenaran yang secukupnya apabila mengalami penyakit yang mengeran dengan tiba-tiba. True or false? Only 5 seconds left. 3, 2, 1. Okay. It's true. Okay. Let's see. Okay, Ko Zhangyuan number 4, number 5. Yongfei number 3, Xia Huixing number 2, 897 still got number 1. Okay, next question. 5. Mengapakah seseorang menghadapi pengsan? Jawapannya A. Main game hingga lewat malam atau tidak makan kenyang, berdiri terlalu lama dalam keadaan yang panas atau terlalu stres. Pengsan, keadaan pengsan. 16%, 17%, 19%, 20%, 5 more, 4 more. Okay. The answer is berdiri terlalu lama dalam keadaan yang panas. Okay. Let's see the standing. Ko Zhangyuan is number 1 and Claire number 2. 897 wrong maybe. Number 3 and Desmond number 4. Xia Huixing number 5. Okay, continue. Number 6. Kalau mangsa tidak sadarkan diri, keliru atau mula kehilangan kesedarannya, apakah yang perlu anda buat dahulu? Okay. A is memanggil ambulans, B biarkan mangsa, C memanggil ibu bapa, dan answer yang keempat ialah jawapan yang keempat A. Anda yang perlu buat dahulu dahulu. Okay. Please read carefully the question dahulu. Memanggil ambulans atau biarkan mangsa atau memanggil ibu bapa atau buat CPR. The correct answer is memanggil ambulance. Okay. Next question. Let's see the standing. Kodanya still got number 1. Three player. Let's see the next question. Number 7. Apakah tanda-tanda pingsan kecuali rasa lemah atau berasa bosan, muka pucat, tidak berdiri tegak? Apakah jawapannya? Kecuali kecuali rasa lemah, berasa bosan, muka pucat atau tidak berdiri tegak. Okay. Answer is berasa bosan. Muka pucat dan tidak berdiri tegak dan rasa lemah merupakan tanda-tanda pingsan. Okay. Let's see. Okay. Next question. Apakah yang perlu dilakukan dahulu jika didapati orang dewasa yang tercekik tidak serius? Mulakan CPR, halangan dikeluarkan, gelakkan batok atau beri 5 tepukan belakang dan 5 hentaman abdominal. Okay. 15 seconds left. 14, 15, 12, 11, 10. Anybody have an answer? Then I will skip. 5, 4, 3, 2, 1. Okay. The answer is gelakkan batok. Okay. Because tercekik tidak serius sudah. Okay. Next question. Okay. Soalan yang ke-9. Apakah tindakan yang perlu dilakukan dahulu jika mangsa tercekik itu tidak sedar diri? Tidak sedar diri Please read the question carefully and answer. A. Letakkan mangsa di atas lantai dengan baring terlentang, atau tongkatkan kepala dan rendahkan dagu, atau mulakan 15 tekanan dada dan 2 hembusan pernafasan, atau jangan keluarkan bahan yang dapat dilihat dari mulut mangsa. 3 seconds, 2, 1. Okay, the answer is letakkan mangsa di atas lantai dengan baring terlentang. Okay. Ini ialah mulakan 30 tekanan dada dan 2 hembusan pernafasan. Ini ialah tongkatkan kepala dan tinggikan dagunya. Ini correct answer is keluarkan bahan. Dia perlu keluarkan bahan yang dapat dilihat dari mulut mangsa. Okay, next question. True or false question. Tercekik berlaku apabila terdapat benda asing pada saluran pernafasan yang menyebabkan kesukaran bernafas. True or false? 10% answer the question. Okay, quick. True and false. 2 option. 50%. Okay. The answer is true. Okay, let's see the next question. Okay. Soalan ke-11. Apakah tanda-tanda tercekik kecuali Kecuali nafas sesak, cerai beret, pernafasan terhenti, mulut berbuih. Apakah jawapannya? Tanda-tanda tercekik kecuali. Okay. 2 seconds, 1 second left. Okay, the answer is cerai beret. Okay. Next question. Soalan 12. Apakah perkara yang berlaku apabila tercekik tidak berupaya mengeluarkan bunyi, bibir dan lidah mula bertukar jadi biru, rasa lemah dan tidak berdiri tegak, membatuk dengan lemah atau tidak dapat bercakap, batuk atau bernafas lagi? Apakah yang berlaku? Apakah perkara yang berlaku apabila tercekik? 5 seconds left. 4, 3, 2, 1. Let's see the answer. Tidak berupaya mengeluarkan bunyi. Okay, next question. Okay. Soalan ke-13. Bagaimanakah anda menjaga seseorang mangsa yang sedar diri? Sedar diri ya. A. Terus memberi ubat kepada mangsa tanpa keizinannya, membantu dia untuk bermandi, buat CPR, perhatian tahap pernafasan. What is the answer? This question quite easy. Okay. 16% correct. Perhatian tahap pernafasan. Okay. Next question. Let's see. Soalan ke-14. Apakah yang anda perlu buat jika jumpa seseorang mangsa mengalami masalah pernafasan? Ini ialah typing error. Seseorang mangsa mengalami masalah pernafasan. A. Membuat CPR, mengangkatnya ke tempat lain, memanggil ambulans atau memberikan ubat kepadanya. 10 seconds left. 5, 4, 3, 2. Okay. The answer is memanggil ambulance. Okay, next question. Oh, Nichi has the highest answer rate of 5. This correct the answer. You get the correct answer, continue firstly for 5 round. Okay, now let's see the next question. Posisi sekiranya si mangsa pengsan, menyuruh dia duduk di kerusi atau baringkan mangsa dan angkat kakinya, baringkan mangsa dalam posisi supine, baringkan mangsa dalam posisi menuduk. Apakah jawapannya? Five seconds left. 4, 3, 2, 1. Okay, the answer is baringkan mangsa dan angkat kakinya. Okay, next question. Okay. Apakah diri buat sementara? Si mangsa tercekik dan tidak mampu berkomunikasi. Si mangsa diada dekupan jantung atau nadi. Si mangsa demam dan batuk. 5 seconds left. Quickly. 3, 2, 1. Okay, the answer is si mangsa diada dekupan jantung atau nadi. Okay, let's see the next question. Okay, apakah punca kalau anda ingin melakukan call semasa sesuatu mengalami penyakit yang menyerang dengan tiba-tiba? Panggil ambulans kalau mangsa tidak sedarkan diri, terlalu lapar, kehilangan kawalan badan, nafas bersakit pendek. What is the answer? Five seconds left. 4, 3, 2, 1. Okay, the answer is panggil ambulans kalau mangsa tidak sedarkan diri. Okay. Let's see the question. Next question. Apakah yang perlu dibuat apabila mangsa hypoglycemia? Kecuali ya. Please read carefully the question. Rehatkan pesakit, hantar ke hospital, biarkan dia sahaja, berikan minuman dan makanan manis. Okay. Yeah. You didn't see the question carefully. Kecuali ya. Okay. Next question. Apakah yang boleh anda lakukan apabila menjumpa seorang diserang sawan? 1. Jauhi mangsa dari bahaya. 2. Longgarkan baju yang ketat. 3. Letak dalam kedudukan koma selepas tenang. Hantar ke hospital jika ia tidak pernah berlaku. What is his answer? 1 and 2, 2 and 3, 2 and 4, or all of the above? Okay, 4 seconds left. 3, 2, 1. Okay, answer is all of it. All of the above is correct. Okay. Let's see the last question. 20, soalan ke-20. Last question. Apakah yang tidak boleh Anda lakukan semasa menerima seorang pesakit yang mengalami hypoglycemia? Beri banyak minuman manis, hubungi ambulans, jaga tahap kesedaran nafas dan nadi, atau beri teh yang mengandungi garam. Apakah jawapan yang betul? 3 seconds left. 2, 1. Let's see. Okay, the answer is beri banyak minuman manis. Itulah ialah jawapannya. Tidak boleh Anda lakukan. Okay? Let's see the podium. The third prize goes to Ko Zhangyun. And the second prize goes to Alexandria. And the first prize goes to 890. Okay, congrats to the winner. Number 4 is Yongfei, and number 5 is Nicholas Lin. Okay, congrats. Okay, that's all from us. Thank you.
Oh, kehadiran.
Okay. Sila ingat untuk isikan form kehadiran.